on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. This week's ramp-up in vaccine delivery is welcome news. However, increasing case counts, shifting severity trends, and a rising proportion of cases involving variants of concern is a reminder that we are in a very tight race between vaccines versus variants. The total number of cumulative cases of COVID-19 now exceeds 950,000. Active cases have increased to almost 39,000, and increasing variants of concern cases are now accounting for a high proportion of new reported cases in the most heavily impacted provinces. To date, over 7,100 variants of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these cases.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur l'épidémiologie nationale.
Today, we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. This week's ramp-up in vaccine delivery is welcome news. However, the increase in case counts, shifting severity trends, and a rising proportion of cases involving variants of concern is a reminder that we are in a very tight race between vaccines and variants. The total number of cumulative cases of COVID-19 now exceed 950,000. Active cases have increased to almost 39,000, and the increasing number of variant of concern cases now account for a high proportion of new reported cases in the most heavily impacted provinces. To date, over 7,100 variant of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these cases.
Dr. Tam, you might be on mute.
Okay, thank you. So on slide 1, the declines in daily cases and severity trends presented at the last update have unfortunately begun to reverse. Daily case counts have increased over 30% in the past 2 weeks, with a national average of over 4,050 new cases reported daily. Case counts are elevated and rising. Likewise, following weeks of increased disease activity, the lagging indicators of COVID-19 severity are beginning to increase. On average, over the past week, 29 deaths were reported daily, and close to 2,200 people with COVID-19 were being treated in our hospitals each day, including over 600 in critical care.
Diapositive 1.
Slide 1. The declines in daily cases and severity trends presented at the last update have unfortunately begun to reverse. Daily case counts have increased over 30% over the past 2 weeks, with a national average of over 4,050 new cases reported daily. Case counts are elevated and rising. Likewise, following weeks of increased disease activity, lagging indicators of COVID-19 severity are beginning to increase. On average, over the past week, 29 deaths were reported daily, and close to 2,200 people with COVID-19 were being treated in our hospitals each day, including over 600 in critical care.
Slide 2. The time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than one person, the epidemic will die out. Nationally, the RT has been greater than 1 since early March, meaning that every 100 cases in Canada passes the virus to more than 100 others, and so on, with each new generation of spread getting larger.
Diapositive 2.
Slide 2. The time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than one person, the epidemic dies out. Nationally, the RT has been greater than 1 since early March, meaning that every 100 cases in Canada passes the virus on to more than 100 others, and so on, with each new generation of spread getting larger.
On slide 3, COVID-19 incidence is increasing in provinces west of the Atlantic region. Variants of concern represent an increasingly high proportion of reported COVID-19 cases, with estimates ranging from 5% to over 50% of new COVID-19 cases in these areas. This raises the risk of spread into new areas where rapid acceleration of growth can occur. Early, strong, and sustained community-based public health measures and consistent adherence to individual practices work best to slow growth, maintain low levels of activity, or eliminate transmission from an area.
Diapositive 3.
Slide 3. COVID-19 incidence is increasing in provinces west of the Atlantic region. Variants of concern represent an increasingly high proportion of reported COVID-19 cases, with estimates ranging from 5% to over 50% of current COVID-19 cases in these areas. This raises the risk of spread into new areas where rapid acceleration of growth can occur. Early, strong, and sustained community-based public health measures and consistent adherence to individual practices work best to slow growth, maintain low levels of activity, or eliminate transmission from an area.
Slide 4. COVID-19 hospitalization rates are leveling off or increasing in provinces with elevated disease activity. On average, the length of stay for people hospitalized is about 2 weeks, or close to 3 weeks for those experiencing more severe illness. This means that the number of patients being treated in hospital with COVID-19 accumulates over time, placing a prolonged strain on the health system.
Diapositive 4.
Slide 4. COVID-19 hospitalization rates are leveling off or increasing in provinces with elevated disease activity. On average, the length of stay for people hospitalized is about 2 weeks, or close to 3 weeks for those experiencing more severe illness. This means that the number of patients being treated in hospital with COVID-19 accumulates over time, placing a prolonged strain on the health system.
Slide 5. Over a third of health regions across Canada are reporting high incidence of 100 cases or more per 100,000 population. These are the darker blue areas on the map, including both urban as well as rural and northern regions of affected provinces.
Diapositive 5.
Slide 5. Over a third of health regions across Canada are reporting a high incidence of 100 cases or more per 100,000 population. Darker blue areas on the map, including both urban and rural and northern regions of affected provinces.
Slide 6. The good news is that since early January, incidence rates have declined dramatically among adults aged 80 years and older who've been prioritized in the initial phases of vaccination rollout. Currently, reported COVID-19 incidence rates are highest among young adults aged 20 to 39 years of age. The not so good news is that circulation of COVID-19 in younger, more mobile and socially connected adults present an ongoing risk for spread into high-risk populations and settings and continuing transmission in the community. It is important to remember that although severe illness is less common in younger age groups, serious or prolonged illness can occur at any age, and there are emerging concerns about increased severity of the B.1.1.7 variants in adults.
Diapositive 6.
Slide 6. The good news is that since early January, incidence rates have declined dramatically among adults aged 80 years and older, who've been prioritized in the initial phases of vaccination rollout. Currently, reported COVID-19 incidence rates are highest among young adults aged 20 to 39 years of age. The not-so-good news is that circulation of COVID-19 in younger, more mobile and socially connected adults presents an ongoing risk for spread into high-risk populations and settings and continuing transmission in the community. It is important to remember that although severe illness is less common in younger age groups, serious or prolonged illness can occur at any age, and there are emerging concerns about the increased severity of the B.1.1.7 variant in adults.
Slide 7. In addition to declining incidence rates in elderly adults, the benefits of the initial vaccine rollout are also being seen in high-risk settings, including fewer and smaller outbreaks in long-term care homes since January. However, in parts of Canada where variants of concern represent an increasingly high proportion of cases and are associated with a greater number of outbreaks, we need to maintain a high degree of vigilance to keep COVID-19 infections rates down as vaccine programs scale up.
Diapositive 7.
Slide 7. In addition to the declining incident rates in early adults, the benefits of the initial vaccine rollout are also being seen in high-risk settings, including fewer and smaller outbreaks in long-term care homes since January. However, in certain parts of Canada, where variants of concern represent an increasingly high proportion of cases and are associated with a greater number of outbreaks, we need to maintain a high degree of vigilance to keep COVID-19 infection rates down as vaccine programs scale up.
Slide 8. During the earlier stages of the pandemic from March to September of last year, the territories and most Indigenous communities were successful in their efforts to limit the introduction and further spread of COVID-19. Like many areas of Canada, the winter months presented challenges as COVID-19 continued to spread into new areas, with the rate of new cases in First Nations on-reserve populations exceeding that of the general Canadian population. Reintroduction and spread of COVID-19, including variants of concern, is an ongoing risk for all Indigenous communities. Indigenous communities in remote areas were some of the first to get vaccines, and the success of these programs with high population uptake is providing benefits that will contribute to resilience in these communities heading into the spring and summer months.
Diapositive 8.
Slide 8. During the earlier stages of the pandemic, the territories and most Indigenous communities were successful in their efforts to limit the introduction and further spread of COVID-19. Like many areas of Canada, the winter months presented challenges as COVID-19 continued to spread into new areas, with the rate of new cases in First Nations on-reserve populations exceeding that of the general Canadian population. The reintroduction and spread of COVID-19, including variants of concern, is an ongoing risk for all Indigenous communities. Indigenous communities in remote areas were some of the first to get vaccines, and the success of these programs with high population uptake is providing benefits that will contribute to the resilience of these communities heading into the spring and summer months.
Slide 9. Indigenous communities and the territories have made good strides in increasing vaccine coverage, demonstrating strong leadership in administering vaccination programs across these communities. To date, more than 60% of adults have received at least one dose in Canada's 3 territories. Overall, more than 4.5 million doses of COVID-19 vaccines have been administered since vaccination began in mid-December, providing more than 10% of Canadian adults with at least one dose of COVID-19 vaccine. Nearly 60% of adults aged 80 years or older have received at least one dose of COVID-19 vaccine, which has contributed to reduced rates of infection in this high-risk age group.
Diapositive 9.
Slide 9. Indigenous communities and the territories have made good strides in increasing vaccination coverage, demonstrating strong leadership in administering vaccination programs across these communities. To date, more than 60% of adults have received at least one dose in Canada's 3 territories. Overall, more than 4.5 million doses of COVID-19 vaccines have been administered since vaccination began in mid-December, providing more than 10% of Canadian adults with at least one dose of COVID-19 vaccine. Nearly 60% of older adults aged 80 years or older have received at least one dose of COVID-19 vaccine, which has contributed to reduced rates of infection in this high-risk age group.
Slide 10. Based on Canadian data up to March 20th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to April 4th. The graph on the left shows the predicted number of cases could be in the range of 973,080 to 1,005,020 by April the 4th. The graph on the right shows the predicted number of deaths could be in the range of 22,875 to 23,315 by April 4th.
Diapositive 10.
Slide 10. Based on Canadian data up to March 20th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to April 4th. The graph on the left shows the predicted number of cases could be in the range of 973,080 to 1,005,020 by April 4th. The graph on the right shows the predicted number of deaths could be in the range of 22,875 to 23,315 by April 4th.
Slide 11. In the past 2 months, more contagious virus variants have appeared in all 10 provinces, with the B117 making up an increasingly high proportion of cases in provinces west of the Atlantic region. Nevertheless, more contagious variants present a risk everywhere in the country. More contagious variants like B117 can result in a rapid spike of cases where vaccines may be less effective against variants like B1351. Whereas vaccines may be less effective against variants like B1351. The Atlantic provinces have been able to sustain sufficient measures to manage importations. The Atlantic provinces have been able to sustain sufficient measures to manage importations, interrupt spreads, and maintain strong control of COVID-19. A rapid surge of cases followed the introduction of B117 virus variant in Newfoundland and Labrador. It was quickly interrupted with strong and sustained community-based measures. More recently, a rapid acceleration of incidents in one southeastern Ontario health region elevated their alert levels from green to red in just over a week. This is a caution that the virus can spread rapidly in any community, particularly when more contagious variants are involved. It also serves as a reminder of the need to maintain individual practices, even where COVID-19 activity is low, and explains why health authorities must respond quickly to any increase in case numbers. Controlling infection rates is needed in heavily affected areas. Elsewhere, ongoing vigilance is necessary to monitor, screen, and rapidly respond to any rise in cases to stop a variant of concern in its track.
Diapositive 11.
Slide 11. In the past 2 months, more contagious virus variants have appeared in all 10 provinces, with the B117 variant making up an increasingly high proportion of cases in provinces west of the Atlantic region. Nevertheless, more contagious variants present a risk everywhere in the country. More contagious variants, like B117, can result in a rapid spike of cases, whereas vaccines may be less effective against variants like B1351. The Atlantic provinces have been able to sustain sufficient measures to manage importations, interrupt spread, and maintain strong control of COVID-19. A rapid surge of cases following the introduction of the B117 virus variant in Newfoundland and Labrador was quickly interrupted with strong and sustained community-based measures. More recently, a rapid acceleration of incidents in one southeastern Ontario health region elevated their alert levels from green to red in just over a week. This is a caution that the virus can spread rapidly in any community, particularly when more contagious variants are involved. It also serves as a reminder of the need to maintain individual practices even where COVID-19 activity is low, and explains why health authorities must respond quickly to any increase in numbers. Controlling infection rates is needed in heavily affected areas. Elsewhere, ongoing vigilance is necessary to monitor, screen, and rapidly respond to any rise in cases to stop a variant of concern in its tracks.
Slide 12. A new longer-range forecast model that accounts for transmission dynamics of both non-variant COVID-19 and new variants of concern gives us insight into what could happen if more contagious variants continue to spread in Canada. With more contagious variants spreading, this model predicts that current community-based public health measures will be insufficient to control rapid growth, and resurgence is forecast. That's the gray line. But if a combination of enhanced community-based public health measures and good adherence to individual precautions are implemented and sustained, the epidemic is forecast to plateau. That's the purple line. Adhering to individual precaution means that we all must maintain physical distancing, reduce contacts outside our household to just essential activities, continue with good hand washing practices, and wear well-constructed, well-fitting, and properly worn face masks to protect ourselves and others. For local authorities, this means maintaining or immediately implementing strong public health measures, which may include restrictions, closures, or other community-based control measures to achieve the reductions in contacts necessary to get ahead of or prevent further spread of rapidly spreading variants. We've been saying all along that if we ease measures too soon, before enough people are vaccinated, the epidemic will resurge even stronger. With increasing circulation of highly contagious variants, the threat of uncontrolled epidemic growth is significantly elevated. This is why measures must be stronger, stricter, and sustained long enough to suppress rapid epidemic growth of variants of concern.
Diapositive 12.
Slide 12. A new longer-range forecast model that accounts for transmission dynamics of both non-variant COVID-19 and new variants of concern gives us insight into what could happen if more contagious variants continue to spread in Canada. With more contagious variants spreading, this model predicts that current community-based public health measures will be insufficient to control rapid growth and resurgence. That's the gray line. But If a combination of enhanced community-based public health measures and good adherence to individual precautions are implemented and sustained, the epidemic is forecast to plateau. That is the purple line. Adhering to individual precautions means that we must all maintain physical distancing, reduce contacts outside of our household to just essential activities, continue with good hand-washing practices, and wear a well-constructed, well-fitting, and properly worn face mask to protect ourselves and others. For local authorities, this means maintaining or immediately implementing strong public health measures, which may include restrictions, closures, and other community-based control measures to achieve the reductions in contacts necessary to get ahead of or prevent further spread of rapidly spreading variants. We've been saying all along that if we ease measures too soon, before enough people are vaccinated, the epidemic will resurge even stronger. With increasing circulation of highly contagious variants, the threat of uncontrolled epidemic growth is significantly elevated. This is why measures must be stronger, stricter, and sustained long enough to suppress rapid epidemic growth of variants of concern.
Slide 13. The experiences of other countries demonstrate that stringent public health measures are required to control rapid epidemic growth when more contagious variants are predominating. Several European countries, including Italy, France, and Germany, are experiencing epidemic resurgence, driven predominantly by the B.1.1.7 variant of concern, which accounts for an estimated over 70% of reported cases in each of these countries. In order to suppress a third wave and preserve health system capacity, Italy and France implemented new lockdown measures last week, requiring people to stay home, except for essential reasons, over the next several weeks, and Germany has extended their partial lockdown until April the 18th. Likewise, the United Kingdom has maintained stringent public health measures to allow vaccines to reach a majority of the population. They are only beginning to ease restrictions very gradually, now that over 50% of the population has received a first dose of COVID-19 vaccine.
Diapositive 13.
Slide 13. The experiences of other countries demonstrate that stringent public health measures are required to control rapid epidemic growth when more contagious variants are predominating. Several European countries, including Italy, France, and Germany, are experiencing epidemic resurgence being driven by the predominance of the B.1.1.7 variant of concern, which accounts for an estimated over 70% of reported COVID-19 cases in each of these countries. In order to suppress a third wave and preserve health system capacity, Italy and France have implemented new lockdown measures. They did that last week. The measures require people to stay at home, except for essential reasons, over the next several weeks. And Germany has extended its partial lockdown until April 18th. Likewise, the United Kingdom has maintained stringent public health measures to allow vaccines to reach a majority of the population. They are only beginning to ease restrictions very gradually, now that over 50% of the population has received a first dose of COVID-19 vaccine.
On slide 14, a review of key indicators and local circumstances will guide jurisdictions across the country in their ongoing adjustment of public health measures. Criteria for deciding when to shift public health guidance, shown here, emphasizes the role that vaccines will play as a vital new tool in reducing the impact of COVID-19. If vaccine rollout proceeds as planned and vaccines work well to reduce the spread of COVID-19, we would expect the epidemic to come under control in the coming months and for the other key indicators to improve. When the COVID-19 infections rates are reduced to manageable levels This frees up enough capacity across public health and the health system to respond to surges, with measures in place to reduce spread into high-risk populations and settings. Taken together, these are signs that a jurisdiction may be ready to gradually ease restrictions.
Diapositive 14.
Slide 14. A review of key indicators and local circumstances will guide jurisdictions across the country in their ongoing adjustment of public health measures. Criteria for deciding when to shift public health guidance, shown here, emphasizes the role that vaccines will play as a vital new tool in reducing the impact of COVID-19. If vaccine rollout proceeds as planned, and vaccines work well to reduce the spread of COVID-19, we would expect the epidemic to come under control in the coming months and for the other key indicators to improve. When COVID-19 infection rates are reduced to manageable levels, there will be enough capacity within the public health and health system in general to respond to surges, and there are measures in place to reduce spread to high-risk populations and settings. Together, these are signs that a jurisdiction may be ready to gradually ease restrictions.
Slide 15. There are many factors that will influence when we'll be able to lift most restrictive public health measures safely, to gather with our families and friends, and to increase social and economic activities with preventive measures in place. We will be able to lift measures sooner if we minimize the spread of variants of concern that can increase transmission, severity of illness, and reduce the effectiveness of vaccines. We maintain and adhere to public health measures to keep COVID-19 activity low, and COVID vaccines prove to be highly effective in preventing disease transmission, severe illness, and deaths, as early evidence supports. And if we rapidly increase the number of people offered the vaccine with a high level of acceptance and high uptake of COVID-19 vaccine across the population. Many of these factors are within our control. We are already seeing the benefits of vaccination in high-risk populations and need to keep this momentum going. Widespread vaccination is critical to protect you and your loved ones and to allow us to gather closer together again.
Diapositive 15.
Slide 15. There are many factors that will influence when we will be able to lift the most restrictive public health measures safely, when we'll be able to gather with our families and friends, and increase social and economic activities with preventive measures in place. We will be able to lift measures sooner if we minimize the spread of variants of concern that can increase transmission and severity of the illness and reduce the effectiveness of vaccines. If we maintain and adhere to public health measures to keep COVID-19 activity low. 3, if COVID-19 vaccines prove to be highly effective in preventing disease transmission, as well as severe diseases and deaths, and there are early indications that this may be true. And 4, if we rapidly increase the number of people who are offered the vaccine and have a high level of acceptance of the COVID-19 vaccine in the population. Many of these factors are within our control. We are already seeing the benefits of vaccination in high-risk populations, and we need to keep this momentum going. Widespread vaccination is critical to protect you, your loved ones, and to allow us to gather closer together again.
Slide 16. Today's review of the data and forecasts shows that COVID-19 still has a few tricks in store, and it's clear that we need to hold on together a bit stronger and longer until vaccines have us better protected. While the news of increasing disease activity and shifting trends in severe outcomes is discouraging after so many months of sacrifice, we've made significant progress, and as the warmer days approach, We'll have more options to get outside as we work through this critical leg of the COVID-19 marathon. The ramp up in vaccine supply beginning this week will accelerate vaccine programs, returning more benefits to protect more Canadians. We are closer now than ever, but it is still too soon to relax measures and too soon to gather in areas where COVID-19 is still circulating in Canada. So, as Passover, Easter, and Ramadan approach, make plans to celebrate safely, including having virtual celebrations to protect and support each other as we make this the last big push to keep the path clear for vaccines. Thank you.
Diapositive says,
Slide 16. Today's review of the data and forecasts show that we must continue to put in place rigorous measures until we have a sufficient number of people who have been vaccinated, and then we'll be able to lift restrictions safely. The acceleration of vaccine campaigns will protect more Canadians and will help us to begin getting together again. We are closer to that goal than ever, but it's still too soon to lift restrictions, and it is too soon to gather in areas where COVID-19 is present. So, as Passover, Easter, and Ramadan approach, make plans to celebrate safely, including having virtual celebrations to protect and support each other as we make this last big push to keep the path clear for vaccines. Thank you.
Thank you, doctors. We will now open the phone line to questions. Please identify yourself and include the media outlet that you are representing. We'll be taking questions in both official languages. We ask that you limit yourself to one question and only one follow-up. Donc, nous allons prendre vos questions. Veuillez vous nommer, nous dire quel média vous représentez.
We will now take questions. Please name yourself and say which media outlet you represent. And please limit yourself to one question and one follow-up question in either official language. First question.
Merci, thank you. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Please press star 1 at this time if you have a question. The first question is from Marika Walsh of the Globe and Mail. Please go ahead.
Good morning, Dr. Tam. Thank you so much for taking our questions. Yesterday, the Auditor General said that the Public Health Agency essentially was using the wrong assessment tool to assess the risk of the pandemic early on, and that it was only at your own intervention that the risk level was changed from low to high in mid-March. Can you tell us when you personally first thought that the risk was high to Canadians?
Well, I think there's different ways to look at risk. So the tools that were provided, and if you actually go back to what I said over, January, February, and March, while the domestic risk at that moment in time was low, we had very few cases and they were managed. I kept saying the window of opportunity is closing right now. This is the time to prepare for something worse to come because of what was going on outside of Canada. So I think partly is that the sort of messaging and soundbite doesn't sort of reach the full soundbite that I was providing. But at the same time, I think public health agencies, the way we look at risk, need to be more in the forecasting of the future mode, if you like, and be able to communicate that. And so, as you see in the modeling session today, is trying to do that much better than what we were, I think, and be able to illustrate not only, the epidemiology as we see it now, but what could happen in those forecasting kind of models. And so we need to be the public health system writ large and globally as well as domestically need to be prediction organizations and not just being able to assess the risk of that present moment. It was not wrong. It's just that it is important to also provide what that future state might be like. And so I think as the minister has said, we take the Auditor Auditor General's recommendations to heart, and we look at the next iteration of where we will go to in the future.
I'm a bit confused by your comment saying the risk assessment was not wrong. It seems to contradict what the Auditor General said yesterday, that the risk assessment was wrong. I'm just wondering, though, can you answer the question, when did you first think the risk was high for Canada?
So, as you sort of pointed out, I mean, the domestic risk at that moment in time for the cases in Canada was relatively low. So if you were in Canada during that time. Prior to that, though, we did so many things in terms of preparing, getting the lab testing, airlifting people from areas of concern and building up those sort of responses, meeting with the provinces, even from the initial
moment.
Can
you just tell us when you thought it was high? But when did you think it was high?
Okay, so the risk from the outside, I think, is when you can see that the world has lost containment. I mean, obviously, it wasn't then limited to countries that, China itself and where the surrounding countries. So I think certainly prior to the WHO announcement of a pandemic, we knew that essentially what the WHO said was you can't contain this thing, and countries have tried, but it's impossible to contain and limit to specific geographic areas. So I think Europe, having been impacted, and we were looking at Italy and other places, that certainly makes the risk that much closer. And that sort of panned out, as in fact our importations, our greatest risk were from Europe and from the United States. And so I think around about that, so definitely prior to the WHO sort of, pronouncement, if you like, that we're in a pandemic situation, for sure, the world was looking like it was going in that sort of trajectory. And it was inevitable that a pandemic was happening.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Merci. La prochaine question est de Catherine Lévesque, La Presse canadienne.
Catherine Lévesque, La Presse canadienne, you have the floor. Question.
To follow up on that, I guess what we're trying to find out is, did you change the risk assessment after pressure from the health public officers from the provinces, or did you decide to intervene by yourself? So we're just trying to find out what the timeline is on making that decision. Thank you.
Yes, I think March, the end of February, that March timeline, and before, the WHO indicated it was a pandemic, it was pretty obvious even though the number of cases were quite low in the country, I think there were certain markers, and I would have to go back and look at the exact date. So after sort of specific travel-related cases, and we now know that the virus was coming in invisible ways in asymptomatic people. But there was one single moment in British Columbia, and I have to find a date, where we had no link. So you now have a person who was not linked to a specific travel situation, which means there was the chance of community spread beginning to happen. And at that moment, even though it was localized to one single province, we know, I think, for the country, the risk needs to be shifting to portray that risk itself. So it would have been, so what happened, I as everybody knows, I've been meeting with the chief medical officers several times a week ever since in January. It's not a singular decision one way or the other. Collectively, we thought, okay, well, even though the precise assessment at that moment in time in terms of just the cases we were seeing was low, we need to shift that narrative. We need to shift what we think the risk is. So for sure, I really look back and go, it can't possibly be low. We've got this trajectory looking forwards is escalating. And so that's the sort of timeline, if you like. Not to say that we minimize what the potential for this pandemic in Canada in terms of preparedness, but for sure, I mean, I think if we all look back, I think my brain's trying to shut out some of those moments, but none of us forgot. So there's somewhere in that early March timeframe with this is not a containable thing. Cases are gonna come, and we must rapidly escalate our measures. So I think it was around that time frame. And no, it's not just provinces pressuring us or anything like that. It was a collective, discussion, really.
It's Dr. If I could just add to Dr. Tam's response. I would say that, it's not a single point in time in which, suddenly we say, the risk assessment say there's a risk to Canadians. I think right from the beginning, as Dr. Tam pointed out, she contacted the other chief medical officers of health. Meetings were starting already from sort of early January, and it has been regular ever since. And even for myself, I could say that since the first week in January, we were having regular bilat meetings with the CDC to also exchange information, to compare our risk assessment notes in terms of what was happening both outside of North America and our respective countries, but also what the risk may be in terms of the risk to both Americans and Canadians. And so that work was always ongoing. It's not something that just happened at a single point in time. So I think that's important to stress. And certainly, I think some of the touchstones, I think, as Dr. Tam mentioned, with our good surveillance system here and close work with the provinces, territories, I think for me, there are 2 points that really signaled that the transmission was certainly getting, as they say, closer to Canada, and in the sense that we had a case reported, and obviously protecting confidentiality and so on. But there's a case reported in Canada in which the only travel, and this was a person coming back to Canada, was travel to Iran. And even Iran at that point in time had not reported any cases or any concern with COVID-19. So we, in many ways, with our surveillance system in Canada, picked it up first. We reported to the WHO in terms of good information exchange internationally, and that was a signal point. The other part also for ourselves was over time. Initially, the first few cases, as everyone can recall, were associated with travel coming from Wuhan, China. But as we've gone to later January, February, and so on, more and more cases reported in Canada were actually linked to travel from the United States. So that also showed us how interconnected we are, that the cases in Canada were linked to travel from the United States. And of course, in the United States, obviously with their connections to other parts of the world, shows how, the global sort of pandemic really sort of was advancing at a very rapid pace. So I think just to underscore what Dr. Tam said, it's not a singular point in terms of risk assessment at certain date. It was something that was always an evolution since we were first alerted to it late December, early January. Thank you.
Thank you, Doctor. Catherine, question suivie?
Oui, absolument. So going back to Dr. Tam, if I understand correctly, the moment, one of the moments where you thought maybe the risk should change, so it's linked to that specific case in BC where we could see some community transmission, I guess, in Canada. And I just had another, so my follow-up is about the briefing, actually, today's briefing. On page 11, I was wondering, why was Quebec and Saskatchewan, for that matter, excluded from the analysis? And should we understand that the agency still has difficulty getting data from provinces?
So, obviously, the local level response is critical, and they need the data they need to respond to the particular situation. But I think it has, significant, getting data local level up is a big impact on the public health system, which is pretty small. And so I think things have improved over time. And just to sort of benchmark sort of data improvements, I think even in previous outbreaks or pandemics, up until fairly recent, I think with Zika virus, we were getting some case reports. In this pandemic, the province would try to give us things in individual cases instead of aggregate information. So that's sort of definitely a step forwards, but there is improvement over time. We had increased commitment to provide some of the indicators that we were looking for, such as occupation or race, and then to try and make it easier, we've now set up a national COVID-19 public health data portal. But yes, I mean, provinces have their own, I think, challenges in pulling the data also from local levels. So they needed to pull this up. There is not a specific issue with wanting to share. I think the system itself, meaning all levels, and going right down to hospitals, needed to be strengthened. And this is what we're trying to do during, but also I hope in going forwards, that we don't lose that capacity. And I think ministers probably have emphasized the injection of, I think if I can recall correct, $4.3 billion just to support data, lab testing, and contact tracing. And that's allowed us to also move into the development of a pan-Canadian health data strategy. So there are infrastructure and whether it's people or others that have to be supported all the way through the public health system. Just to get back onto page 11, just like we initially got our lab test developed really, really fast in Canada, getting genomics platforms stepped up in order to sequence the viruses has been a massive acceleration in the last weeks and months. So the genomics networks have been stood up. The screening now for mutations, if you knew which mutations we're looking for, the provinces are now screening a huge number of them. And so, I think it's not because the individual provinces are not prepared to give us that data. That data has to be standardized. There's reporting agreements as to, what, are we comparing apples to apples or apples to oranges? All of that has to take place pretty fast. This is the best data we can provide at the national level, and it will improve. But it does give you, overall, a very good picture of the escalation and the replacement of the variants in Canada and in different areas. So maybe I'll leave it at that for now.
Thank you, Dr. Tam. Operator, next question.
Thank you. The next question is from Annie Bergeron-Oliver of CTV National News. Please go ahead.
Hi there. Thank you very much for taking my question. You're calling for more public health measures and restrictions. In Ontario, it seems like the restrictions ease, then cases go up, and then restrictions tighten again. Instead of this sort of yo-yo effect that we've been seeing for months, are you essentially saying that a more prolonged sort of stay-at-home order is necessary to get these variants under control? And can you just be more specific in exactly what type of stronger public health measures you're calling for?
Well, I think every province is different. You've seen how different the Atlantic to the territories to BC to Alberta, but all 6 provinces that are sort of west of the Atlantic are either experiencing or it's likely to experience a resurgence in the coming days and weeks. So, and some big provinces, Ontario, are taking a more regional approach. So there is definitely merit in that, but of course people do travel in between. So that has to be borne in mind. In areas where you have variants, where you have been doing this up and down sort of measure, I think it is a really important approach, perhaps, to not go up and down too much, but sustain a certain level of restrictive measures. It may not be stay at home for every area. It's more you've got to implement measures that work in your community where people are going to stick to as few interactions, as few times, shortest amount of time with the variants escalating. So if there are detections that this activity is ramping up, then definitely don't relax and try and keep that even keel until the vaccines have gained much more of acceleration in terms of coverage. And so, with the approach that Canada is taking overall, just trying to get that first dose into as many people as fast as possible. And with the doses now we're getting, it's possible to get that vaccine offered to everyone before the end of June. So with that in mind, you can think about that kind of time frame and maybe trying to keep a steady state where you're not going to suddenly get these resurgences until that kind of time frame where most people would have at least got one dose.
Thank you. Follow up?
Yes, as my follow-up, there are new reports out today that based on data of hospitalizations in Ontario, the variant increased the rate of death by 60% and may increase the hospitalization rate by 60%. I'm wondering what specific data do you have with regards to the mortality rate of the variant, and how well protected are the roughly 10% of Canadians who have a vaccine against these variants?
They're really excellent questions. I mean, prior to seeing what's happening in Ontario, we could only learn from Europe. And you've seen what happens in Europe and the countries where the variants take hold, both in terms of those epidemic accelerations, but also increasing data over time from the UK and others that the B117 variant, there was less data on the other two, but increases severity of the illness. And so Ontario's data substantiate, I think, what has been seen in Europe. We couldn't really tell until this point in time whether the context and the population immunity, etc., in Canada, how this is going to play out, and our public health measures, much of which is still in place. What does that mean when the variants introduced in the Canadian context? You're now seeing, I think, in much clearer ways in the Ontario context. They are the sort of leader in this area for producing that information for us. And so, yes, they are seeing that it is more transmissible. They've I think earlier on released their reproduction number, that RT number, for the variants versus not the variants. So for the variants, it's definitely over 1, somewhere between 1.2, 1.3. 100 people passing on to 120 others, not a good scenario. And then they've now released the data that is showing, there's 60% increase in risk of hospitalizations, 100% increase in admission to ICUs, 60% increase in the risk of death. And these severity indicators can be seen across all age groups of the adult population. This is a very important set of information that should drive home to all of us why it's important to maintain these measures, and that even younger Canadians, the older people in Canada might be better protected. Just look at that incidence curve in the 80 plus and then the severity indicators. But the younger population, if you let those numbers go up, just by the sheer numbers alone, you're going to get some people who are going to end up in hospital. But given the B117 is more severe, you're going to get more younger age groups into hospitals and ICU. So escalating the vaccine to try and cover as many people as possible is a good strategy. And that's why I think NACI, the National Advisory Committee on Immunization, as well as the provinces, taking into account the likelihood of us having a resurgence, the vaccine amount that we have, and trying to protect everyone, not just the individuals who are at high risk, but the people who can give the virus to them. Vaccines are never 100% effective. You can protect yourself, but the other people around you need to be protected. For that, we protect each other approach to take hold, which is why, look at the United Kingdom. They haven't relaxed much measures while their vaccine coverage is going up to, I think, 50% now of the population receiving one dose at least. So those are the kind of lessons that we have to learn. We didn't know how the vaccine was going to perform in real life. Now we're getting more and more information. So I think if you look at Ontario, then why would we think this would be different anywhere else in those other bigger provinces? As soon as those variants take hold, things could escalate. So ease anything, and you have to be really thoughtful about it at this point in time. With the other aspect, with the higher risk populations, the vaccinations have gone quite well. We're hearing high uptakes in most areas of Canada, in the long-term care residents, and in they're beginning all the community-based, age-based approaches. So I think I hope that benefit that you've seen in some of those graphs continues. This is our first inkling of just how effective these vaccines are in Canada. And there is no way that if it's that effective in older population, that it wouldn't be really great for younger adults. And so we just got to keep going and as fast as we can with our vaccination while holding on to those measures, which is why, every time we hit a sort of a holiday period, we're always a bit anxious. Passover, Easter, Ramadan, times when families and churches and other gatherings typically occur. We want to make sure this does not happen right now, not the time. So we've seen what happens just before Christmas. It's predictable. So if people could please celebrate safely, virtually, as much as possible, it would really help as we get the vaccines out.
Thank you, Operator. Next question. Prochaine question.
Oui, merci. La prochaine question est de Raymond Filion.
Yes, Raymond Filion, TVA Nouvelle. Please go ahead. Thank you. Question for Dr. New. 8,000 people have come into Canada in Lacolle. They've crossed the border. That's what the border authorities are telling us. And Passover is starting tomorrow in Montreal. So there will be gatherings, probably. How can you make sure that those people will be respecting mandatory quarantine?
Je pense que c'est une responsabilité collective.
That is a collective responsibility of the federal government and the provinces and territories. So for us, well, we have a number of measures at the borders. Everyone who arrives in Canada must get a screening test, a PCR test before crossing and upon arrival as well. 10 days later, rather. So while awaiting the result from the test they took before arriving, they must have show that they have a good plan for quarantine. So we have a number of members of personnel who are ensuring to follow up on the respect of quarantine of people who enter the country. But when you talk about regions, it's also a matter of following the public health directives locally. Yes, but as you know, yesterday the agency was criticized severely by the Auditor General for not following up on people who are crossing the border. And now that you know that there are 8,000 people across the border, are you going to deploy special measures? Answer. You've made a comment on the Auditor General's report, but I think that the first 6 months of 2020 we made a number of changes, and we've made changes since then as well, even since the month of December. So really, we have the border officers, and we know, and all travelers must respect the measures that are in place, including the requirement of a screening test before arrival and quarantine and 2 more screening tests, as well as a good quarantine plan. So I cannot make a comment about every event or the number of travelers, but in general, every person who travels to Canada is subjected to the same requirements. Thank you very much.
Merci, thank you. The next question is from David Turton of CBC News. Please go ahead.
Hi, doctors. Hope you are all doing well. I just want to ask you a question about your modeling. It shows that the reproduction number for COVID dropped below 1 to about 0.8 at the beginning of the year. And since the beginning of this month, it's gone above 1. So here's the question. How much of that is an increase in behavior? How much can you attribute that to increase in the way people are behaving? Or how much of that is caused by these variants of concern?
It's going to be both, obviously. I think given that this virus is spread by contacts between people, it's essentially there is, increasing connections between people for sure. That's sort of behavioral aspect. And also specific reporting by province, which shows that there are certain gatherings, some of them were social gatherings, that resulted in transmission. So that's definitely happening. Quantifying it one versus the other over time would be difficult, and it would fluctuate over time, I'm sure. And this is a national level, which is, really macro and doesn't sort of get down to what's happening in each of the communities or the provinces. But for sure, if you look at the graph that shows the identification of variants, they are playing an increasing part, particularly in areas of Ontario. Other provinces are telling us, British Columbia, if you listen to Dr. Henry, she's saying, actually there's spread, but we believe it's due to those social interaction factors and not so much the variants. They're able to look at it at that level. But their variant identifications are also increasing. Alberta, same thing. The role played by variant is increasing over time. I think they've said that maybe over 20% of the cases right now are due to variants of concern. And so you can go across each provinces and be able to identify that both social mixing as well as then the increasing variants possibly has a great impact. And they're quite regional in nature right now, but no area of Canada is immune from the risk of introduction. And you've seen how the Atlantic provinces, for example, are trying to clamp down on that using circuit breakers and things as soon as they identify these variants. So I always say it's a mix, and it's difficult to tease out.
Yeah, it's Dr. Newman. I would just underline a point that Dr. Tam has made, is that when you look at the variants, the mode of transmission is the same as sort of the original strain, if you want to call it, that was introduced into Canada. And so I think the fact that it's becoming an increasing proportion of the cases reported in Canada is also an indication that obviously the number of contacts, the interaction between people is very important. And if it is more transmissible, it just underscores the importance, as we've been stressing all along. It's a combination of the public health measures, but also the individual practices that we've been harping on so many times. Individual hygiene measures, hand washing, the face mask, the physical distancing. Having said that, you look at the experience of other countries like in the UK, where obviously the variants are the predominant strain, but you can see that if you put in very tight public health measures, you can control it. And the same thing here in Canada with what happened in Newfoundland, Labrador. So I think the underlying, important lesson or thing that the Canadians should take away from this is that we can't let down our guard. The vaccination is rolling out. Certainly, it's on a good rhythm right now. But in the meantime, we need to hold on and really continue with the strict observance of the public health measures as well as individual practices. Thank you.
Thank you, doctors. David, follow up?
Yeah, you spoke about listing measures, the hope of listing measures in your presentation. What does your modeling show, or when do you hope, if we do what you have been saying, Dr. Tam and Dr. New, that we can return our lives, that we can return to normal? Dr. Tam, you're a runner. When can you, book that marathon race? So, Dr. New, you like hockey, I think, or sports. When can you go to a Habs game? When are you hoping that life can return to normal?
Yes, so I think, first of all, any public health guidance is depending on the transmission in the community. So clearly right now is not, because your curve is going up. The variants are accelerating in different areas, and your vaccine is low. Those indicators, I think on one of the slides, those are the factors. But if you take all of those factors into account, there's another slide basically showing a more optimistic picture over time, where people can gather maybe outside and then with the proper spacing, being able to sort of be entertained safely, which, will occur over time. There is not going to be a date, right? So here is a date, and after this date, it's all going to be good. I like some of the UK sort of thinking, which is data, not dates. But the dates benchmarking, roughly when things could veer towards what we had before. Thus, I think the vaccines will play a key role. So if through, patience and tenacity, we don't let this resurgence get out of hand, the vaccine uptake is good, and that's always a bit of a question. I think the uptake is great right now in high-risk populations. But unless adults of any age picks up the vaccine, it will slow down when that could occur. I think with one dose of vaccine for everyone, and that helps sort of slow down any kind of resurgence. You might be able to keep the epidemic at a manageable level as provinces are trying to balance reopening and vaccination. What they will then be able to do is, instead of yo-yoing up and down, is that when they relax their measures, they won't have to clamp back down on it again. The most, it's difficult to say, but if you think of people being able to get 2 doses by September, by the end of September, that's been a milestone that we've been aiming for. I look towards a 4 where you don't have to continuously put in restrictive measures. You're going to be able to go back into your social spaces, schools, universities, in a way that you can manage and not have to keep shut things down. So that's the sort of goalpost we should be aiming for. If that's the picture in one's head, we might be able to sort of go, okay, now we know. That's what we're aiming for. So I do think that with all those caveats in place, in the summer, it's always easier to resume certain activities, right? You can do so many more things outside. You can resume a lot of those patios, better spaced out. And then by the fall, that's what I think we should be aiming for, that you don't have this constant up and down. People can then resume, but with certain measures in place. I do think those personal protective measures, until we know more about how vaccines work, what happens to variants, maintaining those habits on an ongoing basis is your sort of baseline of protection. But I imagine if everything goes well, a summer that has people doing more, and then in the fall, not going back to, these very strict and stringent approaches.
Yes, Dr. New, I think I just underline a couple of points that Dr. Tam made. I really like this thing about it's the data, not the dates. So if you're looking about the question when we can resume, quote, activities, I think it's all guided by the epidemiology and the indicators that we spoke about in our presentation today. And that's all the result of, as we've always said, individual actions. The individual actions of Canadians today will matter because they have consequences down the road. So if you want to be able to resume, certain activities at a certain point in time, we'll look at the indicators, the epidemiology. What is the case rate? What is the rate of hospitalizations, severe disease, and so on? And at the same time, obviously, as the vaccines get rolled out, we're also hopeful that, as more and more Canadians get vaccinated, that's another tool, another layer of protection that would also get us to where we want to be in the future. So I think, as they say, it's maintain the course, keep up your personal protective measures, and as we go along, we'll keep looking at the data, and that'll guide us in terms of what we're able to do. Thank you.
Thank you, doctors. Time is flying. We have for one last question. Une dernière question, opérateur.
Merci. Et la dernière question est de
Laurence
Martin de Radio-Canada.
Question from Laurence Martin from Radio-Canada. Please go ahead. Question. Yes, before my first question, I would like you to repeat in French what you just said with regard to your goal for the end of September. So when can we expect things to go back to normal, just before I ask my question? Thank you. Answer. Yes. So I think that when you talk about going back to the way things were before, I'm not really sure that it's a question of dates. It's more of a question of hard data. Because as we go along, it's very important to base ourselves on indicators like the incidence rate, the hospitalization rate as well. It's very important to underscore the following point. It is very important what Canadians do today because there are always consequences 2, 3, 4 weeks down the line. So it's very important to continue individual practices like hand washing, social distancing, and all of that. And gradually, we will see, because at some point, if all of the indicators are showing that the situation is more under control, well, it's sure that public health authorities will be able to start considering loosening restrictions. But that's something that we can't really give a date for. That is going to be based on the data and on epidemiology. So I have a question, because you were talking about stricter measures right now. Does that mean that 250 people in places of worship, opening movie theaters and restaurants, for example, it's not a good idea? Well, the authorities of provinces and territories know more about the situation in their province or territory and the situation on the ground. But with Easter, that's coming next week, it's not a good idea to increase the number of contacts. It's very important to limit the number of contacts to the people in your household. So maybe if I can give some advice, It's a very difficult time when it comes to the spread of variants of concern, because we can see here in Canada that variants are starting to become a higher proportion of cases. They spread faster, and we have the report in Ontario that shows that there can be more severe consequences for variants of concern. So in my opinion, I think it's important to show a great deal of caution. And think about how quickly public health restrictions can be loosened. Dr. Tam, did you want to add anything to that? Yes, I would like to add that it depends on the regional epidemiology. There can be some openings of outdoor restaurants, for example, or outdoor areas. And also, perhaps when you move from stage to stage, to have more time between stages when you're thinking of relaxing measures. But for the most part, this is not the time to loosen restrictions, particularly if you're in the bigger provinces where there is an increase in the spread of variants. There has to be more caution, according to me. Thank you. My follow-up question has to do with the report by the Auditor General yesterday. So I was wondering, Dr. New, do you have any regrets? Do you say to yourself that there was something that you should have done differently to avoid the spread of the virus in Canada? Should there be an alert that was sent out earlier in Canada? What do you think of that? Answer. It's always difficult for me, but I always try to keep a positive outlook. We, of course, accept all of the points and recommendations in the Auditor General report. So my attitude is, well, if we have recommendations, well, then we have to analyze those recommendations and see what we can do better. It's the question of improving with an eye to the future. We learned a lot, but I think that the situation in Canada is similar to the situation in many other countries. It's an unprecedented pandemic, and lessons were learned all over the world. Canada is not an exception to that, and we are always ready to learn from our experience to be able to continue to do better in the future. Thank you. Thank you, doctors. That concludes the technical briefing.
Please note that